Come in.
Hi, Mrs. Seeley.
Yes.
My name is Mike. I'm the nurse practitioner we'll be seeing you today.
Okay.
What may I call you?
Chris.
Oh, nice to meet you.
Nice to meet you.
Okay, can I have a seat?
Yes, please.
Prior to coming in, were they able to get your height and weight?
Yes.
And also check your vision?
Yes.
Good. And also prior to coming in, I've washed my hands, and you understand what we want to do.
Yes.
Good. We want to do a full physical assessment, go from head to toe. Be very systematic about it. I will explain everything as we go through it. If you have any questions, please stop me and just let me know. And this will involve me touching you, and if you have any, like I said, if you have any questions or concerns, please let me know. It'll start with observation, and then palpation, and then auscultation, and listen to things. And sometimes there'll be some percussion in there where I just listen. All right? So I will start with your head, your hair, your eyes, your nose, your mouth, your ears. That's where we'll start. So first of all, I'd like you to take your glasses off. Now, we're just going to look at your face. Then look at the symmetry of your face, look at your eyebrows. And I noticed that they come to the outer canthus of your eyes. And I see you probably also do a little waxing. Okay. And I see that your eyelashes grow outward. But I don't see any exudate or any kind of puffiness in your eyes or anything like that. Your sclera are clear. Looking at your eye, your ears, and the little auricles or your ears are just above the outer canthus, which means that they're anatomically placed. Your face is round. Your nose is right where it's supposed to be, right in the middle. I can see your mouth. Your vermilion borders with your lips there's a very distinct area between that and your skin. I don't see any obvious rashes, lesions, or anything on you that would be of any concern to you right now. Now, what I want you to do now is just do a couple of things. Just squeeze your eyes shut real hard. Good. Furrow your brow. Okay, smile real big. Frown. Okay, puff out your cheeks. And then pucker your lips. Stick out your tongue. Move it from side to side. Okay, now hit it. See through the roof of your mouth. Say the letters L, T, D, and N.
L, T, D, and N.
Good. They're supposed to be very distinct and clear, and they were. So, let me grab a pair of gloves.
Okay.
Before this, I will be palpating. And I'll first start with the front of your forehead, and I'll progress towards the back. I'm going to be feeling for the texture of your hair. I want to make sure it feels nice and soft, not brittle. If it were brittle, I'd be concerned about some hypothyroidism, which I understand you do have, correct?
That is correct.
So I'm going to feel first, feel around your frontal sinuses. Do you have any tenderness?
No.
Any tenderness under your maxillary sinuses?
No.
Okay. I'm going to start up here with your temporal bones, your occipital, parietal, the occipital area. Feeling the texture of your hair, making sure no hair pulls out while I'm doing this. No depressions, no masses, any discomfort.
No.
Good. Now, while I'm here, I'm going to look at your eyes, and we'll make sure that they're symmetrical. And what I would like for you to do is just look up, look at your conjunctiva, and look down. Your sclera is clear, and your conjunctiva are just lightly pink. I don't see any. Do you have any drainage or anything out of your eyes?
No.
I'd like you to squeeze your jaw. Okay, feeling for firmness and tone in your jaw muscle here. That feels good. Do you have any TMJ problems? Do you have any clicking or any noises like that?
No.
Now, what I want to do is just test your sensation. I want you to close your eyes.
Okay.
And I want you to tell me where I'm touching.
Okay.
Keep your eyes closed.
Forehead. Chin. Cheek. Left cheek. Right cheek.
Good. Now, I'm going to go ahead and feel your eyes. Close your eyes for me. I'm going to push on your eyeballs a little bit. Get just a little firm, which is the way they're supposed to be. I'm going to feel your lacrimal gland. Make sure it's not boggy or full. Your lacrimal apparatus, which we tear ducts and everything. Make sure everything drains okay. There's no puffiness, no periorbital edema. Any tenderness or pain?
No.
Okay. Now I want to check your vision. Now your extraocular eye movements. Okay. So to do that, first of all, just look at me. Look at us. I want you to follow my finger. Okay. Just follow your gaze. Here, 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 here. How many fingers am I holding?
2,
One,
3,
one,
2, 2, 2, 2, 2.
Okay. Now, I want you to cover your eye with this occluder. Pick an eye. Good. Now I'm going to divide your pupil into 4 halves. I'm going to divide it so I want to see how well you see.
Okay.
And I want you to tell me what I'm doing with my finger.
1,
Look at my nose.
1 wiggling.
Okay. Now tell me when you can see it.
I can see it now.
Come on. Tell me when you can see it.
I can see it now, wiggling.
Look at my nose. Here.
I can see it wiggling. I can see it wiggling.
Do the other eye. I'm going to do the same thing. Divide it into 4ths. And tell me when you can see.
I can see it wiggling. I can see that.
You can see it.
I can see that. And I can see that.
Okay, with the occluder still there, I'm going to hold it. I'm going to see if you have any, what they call lazy eye or strabismus. Look at my nose again. And what I'm going to do is I'm going to cover your eye, and I'm going to uncover it and see if there's any lateral movement of the eye.
Okay.
I'm going to do this 3 times. Good. You do this with the other eye.
Okay.
Nothing there. That all looked very good. Just going to check your pupillary response. Now, I'm going to do this. Sound in. Good. Good. Now, I'm going to look at this pupil while I'm brightening this eye up here. Okay? And it's consensual. Now, look over my shoulder. I want you to look at that object. I want you to look at the pen. I want you to focus back and forth. I'm going to take this and move it in towards your face. I can see your pupils constrict as it comes closer towards you. Now, the last thing I'm going to do is show you what we call a red reflex. I'm not going to do a full ophthalmology exam, but I do want to be able to look at your red reflex, which is. So I'll do this from about 12 to 18 inches away. Just look right at my picture right there on the object on the wall. Good. Now look over my other shoulder at the object. Instead. That was good. Now I want you to just look at your ears. Like I mentioned earlier, they are anatomically placed. They're just above the outer canthus. But I do want to palpate them or feel them. So I'm going to go a little bit closer. Just going to feel. I don't feel any nodes or nodules. Yep, a couple of piercings there. And I'm going to whisper something in your ear. I want you to tell me what I say.
1965.
That's correct.
2012.
Good. Now, there's a couple other tests I'd like to do. It's called test for bone and air conduction to see how well you hear. There's a family history of hearing loss in your family, correct?
Yes.
Okay. So this would be a O'Brien test, and a Renee test, and a Weber test. First one, we're just going to test for bone conduction. So the way I do this is I use a tuning fork. I'm going to wrap the tuning fork on my hand, and I'm going to place it right here on your forehead. And I want you to tell me if you can hear it in both ears, one ear, or the other ear. And let me know if it's equal or different.
Okay.
Ready?
I hear that equal.
Equal in both ears? Good. Now the second test, I'm going to take the tuning fork, going to tap it, and put it on the mastoid phone right behind here, behind your ear. And I want you to hold up a finger when you can no longer hear it.
Okay.
As soon as that happens, I'm going to move it towards your outer ear, and I want you to hold up another finger when you can no longer hear it again.
Okay.
Good. Do the same thing with this other ear. You actually seem to hear it a little bit longer on the right ear than you do on the left. Okay?
Okay.
Now I want to actually visualize the inside of your ear.
Okay.
So I'll look at, you have a preference on which ear I look at first?
Mhm.
Okay. Now I'll just have a look at this ear first.
Okay.
I'm going to inspect the outer area of it first, make sure that there's no drainage, there's no foul odor or anything coming from it that looks amiss. And I don't see any nodes or nodules on the inside. So I'm going to go inside and just take a look here. Pull a little bit up on your ear. Okay, I can see the tympanic membrane. I do not see any redness in the auditory canal. There's pearly gray. I can see the cone of light. The tympanic membrane is not bulging. It's not retracted. And I don't see any fluid behind. I see just some bony structures behind the tympanic membrane. That looks good. So inside. Pull up just a little bit. I'm sorry. Okay. Okay, the same thing with this ear. I see the cone of light. No retraction, no bulging of fluid. See the bony structures behind the ear. I'm going to pull out just a little bit. There's no redness, no cerumen, no flakiness. Good, looks good. Now, while I still have my hand in line, I'm going to look at your nose. And I see that it's, your nose is right where it's supposed to be. Your ears are oval. And I would like to just take a look up. Tilt your head back and shine a light. And your turbinates are just lightly pink. They're moist. Your septum is midline. So just a little. Okay, I don't see any crusting or drainage. And that's good. Now, how's your sense of smell?
It's good.
Okay. Well, first of all, what I'd like for you to do is I want you to close your eyes. And I want you to include one of your layers. I want you to tell me what you smell.
Vanilla.
I'd like for you to include your other layer. Keep your eyes closed. And just tell me what you smell.
Alcohol.
Good. Okay. Now, close your other layer. Here, tell me what you smell.
Alcohol.
Good. Close your other layer. I'm not trying to get you confused, I swear. Okay.
Vanilla.
Good. All right. Your sense of smell is excellent. Next thing I'd like to do is go to the, one of the things I really didn't do with your eyes was I did not look at your pupils. So I do want to look at your pupils and see how they. Oh, I did look at your
I
pupils.
think you did.
Yeah, I did.
Yeah.
I'm sorry.
That's okay.
Okay.
I think you did.
Yeah, I did. So I'm going to move on to the mouth.
Okay.
So I'm going to look at your mouth. I want you to smile real big for me again. Good. Okay, you have good dentition. You looking open. Look inside. Looking at your buccal cavity. It's pale pink. Your gums are, I'm sorry, I'm going to push inside, okay?
Okay.
Gums are, no, there's no bleeding, they don't appear to be receding. Do you see the dentist regularly?
Yes, I do.
Good, okay. It's funny for me to ask a question when I get my finger in your mouth. Okay. And look up. Good. Good. I'm looking at your soft palate, now your hard palate, your tongue. All looks pink. Now this is the part that everybody dreads. Are you ready? What I want you to do is I need to actually visualize the back of your throat, your posterior pharynx, and also your palatine tonsils. And if you have them. Do you have tonsils?
No,
No tonsils are out. Okay, I just want to make sure there's no erythema or redness or any drainage coming down or anything that looks yucky.
Okay.
Okay, are you ready?
I'm ready.
Okay. Let's see. Okay, let's start off. Tilt your head up just a little bit. Okay, I know you don't like this. Open your mouth. Okay, open your mouth. Yes, take this as. Okay, say ah. Good job. Okay. Your little uvula, the little hangy down thing, was midline, and when you did that, it didn't like it. I could tell. But your soft palate moved, so that was, and it was symmetrical, so that's good. So, and we've gone through the mouth, and we looked at your tongue and the surface characteristics. And I do also want to look under the tongue real quick, because that is a place. You're a former smoker, aren't you?
I am, yes.
Okay. We'll look under the tongue. Make sure that there's no plaque or anything that could cause any. That's the first sign you get oral cancer. I'll stick my tongue with finger in.
Mm-hmm.
Okay. Any tenderness?
Mm-mm.
All right. Well, that's good. I tested your gag. You don't like that.
I hate
So
it.
now, what I'm going to do is I need to check your mouth. So, you have a history of hypothyroidism, correct?
Yes.
Okay, good. Had any other problems besides that?
No.
Okay. Well, I want to just visualize it first. And the easiest way to visualize your larynx and your thyroid gland is just to have you take a small sip of water, hold it in your mouth.
Okay.
And I'm going to shine a little bit of light, just at an angle. Hold the water in your mouth, tilt your head back just a little, and I want you to swallow. Good. I'm going to do this for you. I just want to take a small sip. Swallow. Good. I look good. Now, this is the part that a lot of people don't like. I need to actually palpate. It shouldn't be too terribly uncomfortable, but if I do hurt you, just let me know.
Okay.
Keep the water in your hand.
Okay.
I'm going to just feel, flex your head forward just a little bit. There we go. Good. And feel your cricothyroid membrane. Okay. Little soft spot there. Go down. And the thyroid cartilage. And right there will be the isthmus of your thyroid gland. So to actually palpate it, or feel the node and to feel the lobes, and to see if you have any nodules, I'm going to push the sternothyroid muscle out of the way a little bit.
Mm-hmm.
And I want you to take a small sip. I'm going to push a little bit. Good. Oh, that's do not feel anything move nicely and go up and down. Now I'm going to do the same thing over here. Feel. And push. Sternothyroid muscle out of the way. Take another sip. Swallow. Good. That feels good. Now, I'm going to check for your range of motion. I'm just turning your head from side to side. Good. That's it. Now, push against my hand. Push. Push. Shrug your shoulders. Push real hard. Good. Now, while I'm at the neck, I'm also going to check your lymph nodes. You have a lot of lymph nodes that extend from the back of your head down your, well, they're all over your body, but primarily what I'm going to look at right now is up here, down your neck, up under your jaw, and your upper clavicles and below your clavicles. So I'm going to start with the back. Use rolling motion with my fingers. Feel your occipital area. Go to the postauricular. And I come down to the superficial cervical, the deep cervical, the tonsillar, and come back up to the submandibular, right under your jawbone, and the submental, right under your chin. I'm going to walk my way back up to pre-auricular, That's good. Now on your clavicles, I'm just going to find your clavicle and palpate here and push really hard. You should never feel any lymph nodes up here. If you do, you let your doctor know right away. Also, your infraclavicular area here. Okay. While I'm here, I'm also going to auscultate or listen to your thyroid gland and also your carotids. Okay.
You don't want to use that one around your neck?
Oh. Thank you. I guess I will use it one around my neck. It's nice of you to remind me that it was there. Okay, so I'm just going to listen. I want you to tilt your head back just a little. Just leave it midline. Now, I just want you to take a breath and hold. Good. Go ahead and breathe normal. Tilt your head back just a little. Take a breath and hold. Good. Okay. I was able to listen to your carotid arteries and also listen to any bruise or anything you might have had in your thyroid gland, if it was hypervascular, vascularized or anything. I would for some crushing sounds. So, next thing I'd like to do is go ahead and just take a look at your arms, your upper extremities. So, I'm going to start with the left arm. So we'll check the tone of your arm. Good. Start. Check the tone of this. Good. Hold your hands out for me. There's no tremors. Palm or side up. Good. Have equal color. No bruising. No rashes. I do see a scar here, a scar there, and a long scar. Ooh, I feel some bolts. Scar here. You have some hardware, don't you?
Yes.
Okay. Does that limit your range of motion?
Yes.
Okay.
That's as far as my range of motion goes with one arm.
Okay, then we won't try and make it go any farther. So, I will look at your hands. I want to just check your joints. I'll start with the distal part of your fingers. PIP, feel your joints. If I have any tenderness, you let me know. Feel any warmth. There's no tenderness, pain. Feel your pulse. Feel your holy pulse. These are not fake nails, are they?
No.
Those are your real nails?
Those are my nails.
Okay. There's no ridging or clubbing. The nail bed is intact. It's not flaking or peeling. And since there's nail polish on, I can't really do a capillary refill, but what I can look at, as far as looking at the pads of your fingers, I can push very brisk. Okay. And take a look at this here. Nice and warm. Nail beds are intact. Nice and nails are convex, concave. You're rounded. Oh, there's no ridge. Hands of your fingers, very brisk capillary refill. Feel your pulse. You notice any warmth or tenderness or bogginess in your joints? What about your elbow?
None.
What about your shoulders? Any pain or tenderness? Okay. The next thing I need to do will be to inspect your back. So for this, what I will have you do is turn around and have your back towards me.
Okay.
Trying to keep you covered as much as you can. Now with this, I'm going to look at your skin. I'm going to notice if you have any discoloration, rashes, or any moles or hyperpigmentation of anything. And if you don't, okay. I want you to take a nice deep breath. Good. I'm going to take my hand. I'm just going to go about the 12th intercostal space. I'm just take a nice deep breath. Good. very nice and symmetrical breathing. Good. I want to feel for tactile frenitus. That would be if there's any consolidation or anything, which I don't believe you have, but I'm going to test for it anyway. Each time I move my hand, I want you to say 99.
Okay. 99. 99. 99. 99. 99. 99.
Good. Now, you've had kidney infections in the past, haven't you?
Yes.
Okay. Now, in the costovertebral area, if there's any tenderness, I'm going to elicit that with what I'm going to do next.
Okay.
If I do, just holler at me and let me know because it might be uncomfortable.
Okay.
Let's do this. Any pain?
No.
Any pain?
No.
Good. Now I want to listen to you.
Okay.
Now, each time I move my stethoscope, I want you to take a nice deep breath in and out through your mouth.
Okay.
Last time. Okay. Lastly, I'm going to do a little percussion. And there's two sounds that I listen for. It's either timpani or dull. And over your lungs, it's going to be timpani. It's going to sound like a drum, hollow drum. I'm sorry. Can you hold that up?
Mm-hmm.
The last thing will be what we call diaphragmatic excursion.
Mm-hmm.
What I'm going to do is I'm going to start up here where it's a sound of hyperresonance
Mm-hmm.
and go down like it's dull. So I want you to take in a very deep breath and hold it.
Okay.
You ready? And hold. Keep right there. Give me a piece of tape.
Mm-hmm.
Now, I want you to go ahead and exhale all your air.
Okay.
And do the same thing. Right there. Okay. Now, you need to do this same thing to the other side. You ready? Go ahead, take a deep breath. I'm sorry.
It's okay.
Now exhale all of your air. You ready? Okay, right there. Oh, sure. Right there. Now I want to do this measure. Just gonna breathe normal. That is about 4.5 centimeters. And this is about 4 centimeters. And that's normal. So I've checked your lung sounds in the back. See if there's any CVA tenderness or costovertebral tenderness. There's not. Okay. Now, the last thing will be I want to This goes along with the tactile firmitus.
Mm-hmm.
I'm going to auscultate again, but I want you to say the words 99 again, but I'm going to listen with my stethoscope.
Okay.
Each time I move my stethoscope, say the word 99.
Okay. 99. 99. 99. 99. 99. 99. 99. 99.
Good. Now I want you to whisper it, and that's called whispered pectoroloquy. You ready?
Okay. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
say the word E.
Okay.
Okay. Each time I move, say the letter E.
Okay. E. 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 E.
Good. Now, if that E had sounded like an A, that would mean there was some kind of consolidation. Are you okay?
Oh yeah. Yeah.
Okay.
It's just from my head.
Okay. So, go ahead, and I want you to turn back around.
Okay.
Where you do the anterior chest. Keep you covered. Don't sit on your glasses. Now, first, I want to just inspect. I would, for the purpose of this, I'm not really going to expose you for this, but what I'm looking for is symmetry of respirations, making sure there's no accessory muscle usage, and which would mean like diaphragmatic, intercostal spaces, abdominal breathing, anything like that. You know, and there's none right now. The respiratory rate is normal. It's about 14 to 16. If you're in no distress, your saturation outside was 99% on your air when I was looking at all the charts. So everything looks good from that perspective. But what I do need to do is I still need to listen and feel.
Okay.
Okay? So when I listen, I cannot listen over the gown. I have to listen to it. It has to be stethoscope to scan.
Okay.
Okay?
Mm-hmm.
And I'll be, if I, just let me know if there's any problems, okay?
Okay.
Okay. So, now, I'm just going to listen first to your breathing.
Okay.
Nice deep breath. Let me go down a little bit farther. Farther. I'm going to come up underneath, and if you could do me a big favor, keep you covered. If you could just lift your breast up for me. Okay. Take a deep breath. Good. Now come to the other side. Lift your breast up for me. Deep breath. Good. Now, the next part will be a little bit of palpating. What I'm going to do is going to palpate for any tactile primitives, just like I did on the back.
Okay.
So, I'm going to go from side to side.
Mm-hmm.
99.
99. 99.
Keep it covered.
99. 99. 99. 99.
Okay. Now, the next part will be actually palpating around your cord and your heart.
Okay.
Now, what I'm going to be feeling for will be your point of maximal impulse, which is usually around the 4/5 intercostal space, about mid-clavicular line. Okay. Now, so I'm going to reach up under. I'm going to use 3 fingers here. Push up. Lean forward for me just a little. Good. Now, what I'm feeling for, any heaves, lifts, or thrills. A lift would be where it like lifts my finger off, like it's an impulse that's really sharp. A heave would be like just rolling my finger off. And then a thrill would be like a vibration. Don't feel any of that. And if your apical impulse was off to one side or the other, and more than a quarter in diameter, then I would suspect something like left ventricular hypertrophy or right ventricular hypertrophy. Now I don't want to listen to your heart sounds. Have you ever been told you have a run or anything?
No.
Okay. Okay. So, about the second intercostal space, just to the right of the sternum. That will be the aortic valve. Just breathe normal. And then forward a little bit. And the pulmonic valve, just to the left of the sternal wall. And then what we call Erb's point is usually around the third intercostal space. That's where S2, which is closure of the pulmonic and aortic valve. And then lastly will be the mitral valve, which, I'm sorry, slide forward for me, just slide forward. Be about the fifth intercostal space with clavicular line. We'll lift up. Good. Now I'm going to go back to Erb's point, which is right here on the third intercostal space.
Mm-hmm.
Now it's usually where you can hear both S1 and S2 equally in most people.
Mm-hmm.
I'm going to differentiate between S1 and S2 right now. So to do that, I want you to look your head up just a little bit. And I'm going to feel your carotid pulse. S1 is the AV valves closing. There's no split. And S2 would be the downstroke of your pulsation of your carotid pulse. And I don't hear a split. I don't hear any murmurs. And I did not feel any thrills. Okay, I want you to look up a little bit for me. And you're really not in the best position for jugular vein distension, but I can take a look here. Usually you need a good 45-degree angle and shine a little light. There's one there. Cuts down here. That's good. Alright, I don't think I have percussed your chest. Did you percuss your chest?
Yeah.
Okay. So I'm just going to listen. Sorry. Good. That all sounds nice and tin-handed the way it's supposed to sound. All right. Now, we've done all that. We've gone through your head, your chest, your neck. Now it's time for the fun part. We're going to look at your abdomen. Okay? So, go ahead and lay on down. Make yourself comfortable. Keep yourself covered. Okay. First, I'm just going to, the order is going to be a little bit different.
Okay.
And I'm going to go ahead and hold this up. Keep you covered. First, I'm just going to observe. I want to observe your tummy. I want to observe your breathing. And also looking for any pulsations, pulsatile movement, any increased peristalsis, like any waves, anything moving around in there it shouldn't be. You have a little striae there from, I think you've had 3 children?
Mm-hmm.
Okay. So, I'm just going to take a look, and I need you to tilt your head up for me. Now, sometimes if you have a hernia or anything, that could pop up, and I didn't see anything right then. So, in this instance, I'm going to observe, then I'm going to listen.
Okay.
Then I'm going to, and I'll eventually palpate, and then I will go ahead and make a cuss.
Okay.
So, and you see how much noise your tummy's making.
Mm-hmm.
Yep, already.
Yeah, I'm hungry.
Already. Good. Okay. Well, and while I'm auscultating, while I'm listening, I also want to listen to several arteries that you have. You have your renal arteries, which are about L1, and they're on either side of midline. And you have your iliac arteries, which are the mid-level of the umbilicus, and of course your femoral arteries, and then your big artery that goes up the middle of the aorta.
Okay.
Okay, so we'll listen to those. Just want you to breathe on it. Find your costal margin. Now through your iliac arteries, just going to come up through here. And lastly, your femoral. They'll be down here just above your inguinal ligament. Find your iliac crest, pubis, there, right above that. Same thing over here. Find your anterior superior iliac crest, your pubis. Right in the middle of that, just above there, will be your femoral artery. Now, I'd like to do some light palpation.
Okay.
Just going to feel. You have 9 areas I really want to concentrate on here. I'm going to do it very light first. If you have any pain, just let me know. Now, I'm going to go a little bit deeper. Do you have any pain anywhere?
No.
This is just going to get a little bit deeper. Same thing. I also want to feel right. I'm not going to see if I can feel your aortic pulsation. No, I really don't. That's not abnormal. Now the next part involves a little percussion. Just going to find the margins of your liver. Okay. So clear this up. Sorry.
Ow.
Sorry. I'll find it. Right in. Look this in. Okay, that is right at 7. So that's about your span of your liver. It's right at 7. That's within normal. Now I want to also feel it, if I can. If your liver is not enlarged, usually you can't feel it. But I'll try and be as gentle as I can. So we go right up under the costal margin. I'm going to use the areas that I have for my percussion as sort of my guidelines here. Come down. I want you to take in a breath. Push. Take in a breath. There. One more time. Way up under. There. That's good. Over here, I'm going to percuss through your spleen. So the spleen overlies the tummy, so sometimes you really shouldn't, it may sound hollow. So, unless you have had a full meal or something.
Okay.
So we come up here where it should be. So feel tympanic all the way around here. So what I want to do is try and feel your spleen. Normally you can't feel the spleen unless you've had have an infection or something like that. So what I want to do, I'm going to take my left hand, I'm going to reach up under you
Okay.
and reach under. And I'm just going to push. I want you to take in a breath. I'm sorry. Take a breath. It hurt.
It's a little uncomfortable.
Okay, I'm sorry. Well, I really don't feel anything. That's not, like I said, that's not unusual. Now, for your kidneys, when you go in the costal-vertebral area, I'm also going to see if I can palpate your kidneys.
Okay.
Do the same technique. Underneath.
Mm-hmm.
Right up here a little higher. Take in a breath. And exhale. Okay. Usually what you can feel is you can feel the kidney slide back down.
Mm-hmm.
Usually you can't feel the kidney
Mm-hmm.
on the left side. Sometimes you can feel it on the right side. Come over here on this side. Push. Breath. Exhale. Okay, hold on. You do it one more time. Reach up. Take breath. Exhale. No. It's not unusual not to be able to feel it. So that's all right. There's no pain or tenderness other than you pushing down on it, correct?
That is right.
So we've listened to your tummy, we've percussed, checked your liver span, palpated for your spleen, felt your kidneys, we're trying to. Everything seems normal there. Now I do want to look at your legs. Okay? So, I'm going to hold this up. Okay, I'm looking for distribution of hair. Your legs are shaved. So, color is good. I don't see any rashes or broken skin, lesions. Your toes. You have good capillary refill with your toes. You have normal sensation?
Yes.
Okay. Any of that hurt?
No.
Okay. Push down. Good. Push down. Okay. You feel your pulses. Legs feel warm. Posterior tibial pulses and your dorsalis pedal. I also don't notice any edema or anything on your legs. Knees are not warm. Do you ever have problems with your knees?
No, I don't.
You're going to feel your popliteal pulse. I want you to go ahead and bend your knee up to 11. I want you to push against my hand. Push, 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 push. Okay. Now push, 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 push. Relax. Lift this leg up. I want you to push, 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 push. Okay. I want you to push, push, push. Good. Okay. Go ahead and sit up. last thing I want to do is I'm just going to feed it along your back here, because I did not do this. Just lean forward just a little bit for me. And feel your cervical spine. And your thoracic spine. Do you have any pain or tenderness?
No.
Down. Your lumbar area. Pain or tenderness? Good. Now, I think we've covered just about everything except your reflexes. So, if you are ready for that, we will check those. And what I will use...
You lost your hammer?
I lost my hammer. Oh, here
No,
it is.
it is.
There it is. So, I will check your patella. Relax your leg. Good. Relax your leg. Good. Try and get it up off the floor. Do your Achilles heel. Oh, perfect. Good. And do your break with that. Relax your arm. Over here. Yeah. Let's go through this here. So your thumb
that one.
push.
Mm-hmm.
Okay. Okay. Yeah, you do. Seem to do better here. Feel that?
Mm-hmm.
Okay. So your reflexes are normal. Now just to summarize everything.
Mm-hmm.
You've gone over your eyes, your nose, your mouth, your ears, your hair, your scalp, your lymph nodes, you've gone over your breathing, your lungs, your heart, your abdomen, your spleen, liver, your extremities, your upper extremities. I've watched you walk into the room, and you walk with a steady gait. You do not use any appliances, a cane, wheel walker, or anything like that. You never have any problems with equilibrium.
Correct.
Okay. Now the other thing is we've also gone over your cranial nerves, which are very important. We've gone over your, which sort of go in order. Your olfactory, you can smell, you can differentiate smells. We've done your optic nerves, which is central vision, and also your peripheral vision. Then the oculomotor, which is 3, 4, and 6, so that we see how your eyes move around. The trigeminal, which is the sensations of mastication or chewing. Your master muscles here. Gone through the facial nerve, if you had any kind of Bell's palsy or something. That's when we had you do the smile, puff out your cheeks, wrinkle your brow. If there had been any asymmetry of that, I would have been concerned. We've done your hearing, which is cranial nerve by 9, which is acoustic, and 8. And then we've done 9 and 10, which is glossopharyngeal and your vagus nerve. And what that does is basically your taste buds, and which we really didn't test, but you said you can taste fine. But it also does your the gag reflex, which is very prominent, and also it works the soft palate, so it stays mid-line. Your spinal accessory muscles, when I did this, and you push up, you shrug your shoulders, and resistance that way. So, and your hypoglossal, which is cranial nerve 12, which is your tongue movement, in and out and off to the sides. So, everything looked normal neurologically, and I think we've covered everything. Do you have any questions about today?
No, you did a nice job.
And it was very nice meeting you, and we'll be getting back with you. There are a couple other things we will do probably. Since you are having some abdominal discomfort with part of your complaint, we probably will do an ultrasound, but I will call you with that and let you know. Okay, it was very nice meeting you, and I hope you have a good day. Go ahead and get dressed, and we'll be in touch.
Thank you.
Thank you.